In your practice, what are the most common risk factors of gout?
There are a lot of risk factors. Some risk factors are modifiable and some are not. For those who are not modifiable, such as age, so whenever you ages, then ages, then probably the chances of hyperuricemia is higher. And for male patients and also for patients with chronic kidney disease, then you will have a higher chance of high urate. And also in patients with chronic kidney disease, it is also notoriously well known to have a high urate level. So these are some factors that are not really modifiable. But for modifiable risk factor, the thing that I've previously mentioned, such as the use of medications such as diuretics, such as aspirin, then perhaps these are some modifiable factors that can be changed using your different practice. But one most common risk factor that is well known to all people is the diet and also the alcohol. So these are the things that we always has to mention to our patients to change their behavior and lifestyle modifications to help the prevention of gout.
And how do you see the link of it with the cardiovascular disease risk factors?
Hyperuricemia is well known to be associated with a lot of cardiovascular risk factor and also comorbidities. So in the patients with hypertension, in the patients with chronic kidney disease, they are always prone to development of hyperuricemia. On the other hand, on the contrary, in the patient with hyperuricemia, they are also more prone to development of higher risk of cardiovascular disease, such as peripheral vascular disease, such as cerebrovascular disease, or even cardiovascular comorbidities. And it was also published in a lot of papers that urate level itself is independently associated with the development of cardiovascular comorbidities and also cardiovascular mortality. And some underlying theory might be there is low-grade inflammation due to the increase in urate level. So the endothelium of the blood vessels of these patients with hyperuricemia will be more prone to damage, and then it causes a lot of cardiovascular comorbidities.